Good afternoon, Dr. Duchin.
Good afternoon, Madam Chair, board members. Thank you for the opportunity to update you on our work related to the Aspergillus outbreak at Seattle Children's. Aspergillus is a microscopic fungus that is found everywhere in our environment, including in the air we breathe. It is not a problem for healthy people or for most hospitalized patients. However, some patients with severely weakened immune system and those undergoing certain surgical procedures can be at increased risk. In Washington State, healthcare facilities are required to report individual cases of certain notifiable diseases, as well as outbreaks of healthcare-associated infections to local health departments. Individual, or sometimes called sporadic, cases of Aspergillus are not reportable in Washington State or nationally. Outbreaks, which are defined as 2 or more cases suspected to be healthcare-associated, are reportable. Last week, Seattle Children's announced a new case of Aspergillus infection and positive air samples from several of their operating rooms. This follows on 3 recent cases reported in 2018 and 3 in the spring of 2019. Aspergillus acquired in healthcare settings is a serious problem and tragic for patients and families. In response to these cases, we notified Washington State Department of Health and brought in national experts from the Centers for Disease Control and Prevention, CDC, and the National Institute of Occupational Safety and Health, NIOSH, to review the situation with us and provide consultation to Seattle Children's. Unfortunately, there's much that is not known about the environmental sources and routes of transmission of Aspergillus in healthcare settings, particularly in air handling systems, and there are no standardized outbreak response guidelines. Both in 2018 and 2019, the actions and plans that were taken by Seattle Children's were carefully reviewed and considered to be appropriate to reduce the risk of future Aspergillus cases based on what was known at that time. Because Aspergillus is so widespread in the natural environment, CDC has advised us that it is not currently possible to reduce the risk of Aspergillus in any healthcare facility to 0. At the time of the 2018 investigation, Seattle Children's shared information about previous cases of Aspergillus, and we've been asked why we did not make a public announcement at that time. The reason is because these cases were isolated, often separated by long periods of time, apparently unrelated and not known to be part of an ongoing outbreak. There were no actions about which we could inform the public to take to protect their health. As previously noted, individual cases of Aspergillus are not reportable and are not investigated by public health. A related question is why we didn't publicly announce the cases that Seattle Children's Hospital reported to us in 2018. In any healthcare-associated infections investigation, our priority is to ensure that any ongoing risk is identified and mitigated, and that the hospital notify and counsel affected patients, which Seattle Children's Hospital did. At the time Children's had reported the new cases to us in June 2018, they had temporarily closed their operating rooms where the problem was identified to investigate and address any issues that were identified, and so no new patients would be exposed. During this time, they were also rapidly developing a response to prevent additional cases with input from local, state, and national public health authorities. When we think there is an ongoing risk for the general public or if affected patients can't otherwise be notified by the hospital, we'll work with the hospital to ensure that the public is notified. After the most recent case in November, we again consulted with CDC and NIOSH. The experts agreed with Seattle Children's current plan to prevent additional cases, while they install additional HEPA filters and a new air handling system. And HEPA filters are a special filtration device for small particles that are thought to be 99.97% efficient for removing particles the size of Aspergillus. Washington State Department of Health is in the process of conducting their investigation currently. Prevention of healthcare-associated infections is a relatively new and rapidly emerging area of work for local health departments nationally. Our response with Seattle Children's is one of hundreds of healthcare-associated investigations or outbreaks our team responded to just last year. Some of our key roles at public health in this type of investigation include ensuring systems are in place to promptly detect and report additional cases and suspected cases, conducting investigations in collaboration with healthcare facilities, and where appropriate, reporting to or consulting with authorities at the Department of Health at the CDC or other relevant agencies and technical experts when assistance is required. To help identify strategies to decrease the risk for further cases and support healthcare facilities in implementing corrective actions. To provide recommendations based on standardized guidance where available and provide additional guidance as appropriate, and to facilitate specialized testing through the public health laboratory system. We hired our first full-time infection control nurse to work on healthcare-associated infections in 2017 through the Foundational Public Health System funding. However, this body of work is large, it's complex, and it's growing, and additional resources are needed. In response to this outbreak, I'm planning to make healthcare-associated Aspergillus infections reportable to Public Health Seattle-King County. This could help ensure all facilities are tracking and reporting these infections in a standardized way and provide an estimate of the burden of this condition, as well as facilitate prompt outbreak recognition. As a first step, I'll convene a working group of experts from King County healthcare facilities, from the Department of Health, and from the CDC to help inform how reporting could be accomplished in a way that would be most useful and practical. There are millions of healthcare-associated infections that occur in the U.S. every year. About 1 in 25 or 1 in 30 patients in the hospital on a given day have a healthcare-associated infection, and there are approximately 100,000 deaths resulting from healthcare-associated infections in the U.S. each year. Healthcare facilities are on the front lines with respect to responsibility for preventing these infections, and public health agencies are beginning to understand how we get involved and what our role is. But clearly, investigation of outbreaks is our primary responsibility, and by enhancing reporting, I'm hoping that we can improve our ability to recognize and respond to outbreaks. So with that, I'll conclude my remarks and be available for questions.
Are there any questions? Depressing.
Madam Chair, if there's one thing I'd like to add, I want to thank the board for the support for Foundational Public Health Services, because by your support, we did obtain the beginning dollars for this first position, which is so important, so that we had somebody to begin to work on this. So I want to thank the board for that support and continued support for this important work.
Thank you. And when I said depressing, I meant thinking of 100,000 people dying every year, and what is going on now at Children's. Is there any new information you can provide about the vaping circumstances?
Yes, quickly, Madam Chair. As of last week, nationally, CDC has reported over 2,100 cases of lung injury associated with vaping. There's been 42 deaths confirmed. You might have seen the article from nationally reported from Detroit about a 17-year-old who had a double lung transplant. That young man would have passed away had not the lung transplant been available. So there's a lot of work going on. In addition, CDC has released information that vitamin E is a problem, and but we want to make sure we note that it's still under investigation, and we're cautious that that's not the only thing that might be a problem. And I want the public to understand that this is ongoing at the CDC level, and as we give information on the cases, we help the CDC look at where this all might be going. So 7 cases in King County have been found with 1 suspected related death. In our department, staff from our communicable disease, our data folks, and our comms have been meeting weekly. We've updated our tobacco and youth marijuana prevention. I sent the board some information that we've put out about vaping, and we've also provided presentations to school administrators, parents. Jeff was leading efforts that put information out so that every school-based health center would be aware. We've also done this with fentanyl, and that's the other thing I just wanted to mention. that fentanyl continues to be a challenge and concern, particularly for youth. We have 78 lab-confirmed fentanyl-involved overdose deaths in 2019 that we shared with the board. We're concerned that's on the increase. And I shared with the board, and I hope you get a chance to watch the really great video that was done that we sent out to schools, and we're encouraging schools and parent groups to share this video. It's how we can talk with teens about the risk of fentanyl. And I know that's been widely distributed and viewed. So with that, Madam Chair, I'll truncate this in light of time.
Thank you, Patty. And of course, we're looking at the legislature taking this up in the 2020 session, which begins, I believe, January 13th. Yes. Are there any questions or comment of Patty? Okay, we will move on then. Let's go back and call the roll.